Hi, Marissa. This is Daniel. Just wanted to comment about the topic of countertransference you brought up here. Now, this the essence of countertransference is us as counselors emotionally reacting to the content of the person that we're in therapy with. Now, I don't see much, of course, myself. I don't anticipate myself doing much of that because I want to work in an ethical way where I can, keep strict boundaries. So I never imagined myself doing this here in this circumstance. But then at the same time, if I was aware of the rape and if I was aware of the pushing towards marriage with what had happened with the molestation and the rape, I believe I would have a difficult time with not acting out in a way, even maybe emotionally, even holding that in and speaking more harshly towards Sherry and the situation that she's trying to get her sister Annie to continue to marry this individual. But this whole idea of countertransference, because I think every one of us would have a difficulty with a client admitting to having knowledge of rape and still encouraging that marriage. But in this sense, I may not know all the cultural background. I may not know the history of conflict that Sherry is coming in to meet with me. She is concerned primarily that her sister won't continue on with the marriage. So if we as counselors um, are supposed to do our job, which is to empathetically listen to the client and to care for their needs and to help and the client with their desires or outcomes for whatever circumstance it is. So if I don't know about the rape or anything, then what we'd all be doing, is trying to help Sherry understand why, or even maybe not why, but help Sherry get a fuller picture of what's maybe happening in that relationship and come up maybe with ideas mutually with Sherry. Working on her goal is to keep the relationship alive between Annie and her engaged husband. I mean, it's possible we could talk about like a pain defense cycle with them, or her. It's possible we could try and work through maybe different ideologies of talking about more of an American cultural ideology or Western ideology, individualistic ideology versus a collective or community based process. And maybe understanding that difference would give Sherry more insight onto the difficulty Anne is having with the relationship. But a lot of it I see hinges on whether we know about the rape or not. In this situation with this, uh, it's almost unfair in this discussion to give us the full picture and then pretend that we don't know the full picture, when we're communicating with Sherry. So that's difficult, to say the least. Now, I think a question to be stated of what to do, maybe it's more an ethical question, but being there is that Asian heritage, and in times of crisis or just in general, with the culture, like you stated, there is a focus on physical discomforts over emotional symptoms. And I wonder if, ironically, Sherry is more emotionally disturbed that the marriage is not happening, and it's not necessarily a physical comfort for Sherry that's being interrupted. Although, how, knowing the whole picture with the rape, Sherry is acting as if it's a physical discomfort that they're dealing with rather than an emotional one. So, anyways, thanks for listening, and we'll look forward to reading more of your posts. Bye.